because of the stigma that comes with mental health, with ethnic communities, they're quite fearful of mental health and fearful of what would happen to them, and perhaps fearful of our medication as well if they're not educated in this environment. But I don't think the questions are asked at assessment about their cultural needs.
I think the fact that numbers have increased so much that we've not asked the question, or it's down as unknown on our demographics, I think that's just not adequate.
That's worrying insofar as why are we on that trajectory?
This could potentially be due to people accessing services more than they used to. This could potentially be because of reduced stigma, so people know more about services, they're more willing to access services.
We are getting a more diverse population on the wards than we were, a few years ago. So it is being recognised more in the communities and accepted.
We're a citywide service. So I think that it's all dependent on the individual and the families. Cultural differences do make it hard for us to capture everybody that potentially needs help and care. The ones that we do get through are involved in other services, so may be involved with social care or immigration or probation.
There's secrecy from the carers and their families about translators, because obviously they don't always want their communities to know their family situation at that time.
Cultures and people have their own reasons why they prefer not to give information about that.
It might be that they have the belief that they are from there. It might be that they're quite paranoid about why we're asking the questions. It might be something to do with how they're presenting at the time, that they might not want to give the information away. If they're being paranoid about people following them, chasing them, or wanting to take them back to their countries, then they won't be open to telling us where they're from.
Statistics do show, and the data does show, that of the overrepresentation of service users from communities marginalised by their race can be a higher representation in seclusion. And so it's breaking down those barriers, and it's going to take time. It's that culture that we have to adopt and gain the trust.
Sometimes there is a reluctance to give that information, especially around ethnicity and religion, because of prejudice that are out there, that media or certain individual groups. People are afraid of being scrutinised or punished or further abuse because of who they are and what the colour of their skin is, and that shouldn't be the case. I think we get the pushback, and everybody's got a right to not divulge that information, but I think it's important that they do, because that can affect the care in a positive way.
Without knowing the groups of people that we provide a service to, we cannot design services to meet the needs of those people.
I think as much information as you can get around the individual is vital to providing the care for that person, isn't it? We're all individual, we all have different parts and different bits of us that make us us.
It's working more closely and collaboratively with our primary care services.
The first starting point is raising awareness, asking the right questions and getting people to feel okay about seeing it for what it is. The next step is confident and safe in asking those questions to service users, and us as a service supporting them if that goes a bit wrong.
If we don't know the ethnicities of people that we are serving, we cannot offer culturally competent and culturally sensitive services to meet patient needs. And if there is an anxiety, then it's about ensuring that we can overcome this together in order to provide the right level of service for service users.
Once it's on the system, it's there, and you don't have to revisit that. Then that's going to provide a wealth of information for anybody that's coming into contact with them, how to treat them, what individual needs they have, how to respect their differences or disabilities, and to understand from a cultural aspect how that might affect their mental health.
Sometimes some of our patients have been abused in the communities, trafficked, they've been treated really badly. But I think what we need is a better system on admitting patients onto the wards.
Staff may potentially mix ethnicity, culture and religion, whereas these things are separate but also have links as well. It's really important that people understand the different communities that live within Sheffield, and I think for staff to increase their knowledge about the diverse communities can be done within their own time through reading, and that can only improve the services that we offer.
Everybody who comes into the NHS comes in because they want to work with people. As an individual, recognise what we do and we don't know. Can we have a conversation as a team? Can I be supported to say, actually, I don't know? And then can I be supported to find that out?
Like with any consultation, you would ask about the person, how they're doing within themselves, about their well-being, about their mental health. And within their history, you may ask about where they were born, were there any issues around the developmental milestones, where they were educated. And within that, you could easily ask, so which particular ethnic background are you from? And then see how that goes. And it's about reading the room. So if the person is particularly unwell in their mental health and the interview is becoming difficult, then you would not necessarily ask that question, but it's about making sure they ask the question at the right time. And if it's not appropriate within a particular setting, asking the person's family member would be appropriate.
I think there's a societal shift, slowly. I think NHS services are working to help provide a service that is culturally acceptable and to provide information across the board that's understandable and making it less of a taboo subject, and that people are able to get information that's accessible, that's understandable, that's in people's first languages.
It's just about making it a normal part of what we do, and so that it's not something special, because otherwise it might potentially reinforce the anxiety that clinicians may have.
There is a need for diversity within the NHS, and I would encourage anybody who wanted to come pursue a career with the NHS to broaden the horizons and broaden the knowledge that we as a team have.